This is an important announcement from your Community Midwifery Team in Milton Keynes, updating you on the changes that we're making to your maternity services in line with the national response to COVID-19. We will be reducing the number of face-to-face appointments that we provide, and we apologise for any disruption that this causes during this really uncertain time, but we are making these changes based on the latest evidence and research. If you are yet to meet your midwife, your booking appointment will now be completed over the phone, and then the midwife will invite you in for an appointment where we can check your blood pressure, urine, height, weight, and undertake any screening tests that are required. At this point, you will then be given your booking notes. The 16-week and the 25-week appointment will now be completed over the phone. All other appointments are still going ahead as planned. However, your midwife will call you on the morning of your appointment to complete a telephone risk assessment. If you are considered low risk, we are asking you to attend your appointments as normal. However, we are asking that you attend alone to minimise social contact. If you are considered high risk, we are asking that we see you at an alternative location and the midwife will wear PPE, personal protective equipment. This will include a mask, gloves and an apron. In order to keep healthy pregnant women away from the sick, we are now moving all antenatal appointments out of GP surgeries and into children's centres and local schools. Your midwife will inform you of which children's centre you are required to attend. If your midwife is not working, it will be the midwife that's covering the clinic that will call you to inform you of this. At present, our home birth service is continuing as normal. All antenatal classes and meet the midwife sessions have been suspended. As you may already be aware, there are now restrictions to visiting within the hospital, and we ask that you identify one birth partner who will be present with you in labour. We then ask that the same person is the person who visits you on the ward if you are required to stay. Postnatally, we've introduced many changes to the pattern of visits. On the first day home, after you're discharged from hospital, you will receive a phone call from a midwife who will complete a postnatal check of you and baby and document this on our electronic system. On day 3, you will receive a phone call from either one of the midwives or the maternity support workers who will check on your well-being and complete a thorough feeding assessment. We're required on day 5 to see everybody for a face-to-face appointment in order to complete the newborn blood spot screening test. If you already have an appointment with us at one of our postnatal clinics, then please keep this, but we will call you on the morning of the appointment to complete a risk assessment. If low risk, we'll advise you to still attend. If high risk, we will see you at home, but we will have to wear PPE. If we are required to attend a visit wearing PPE, we will ask that you allocate a room for us to complete your check and see just yourself and the baby. We'll knock on the door and wait for you to let us in, and then we'll take a step inside and put on our PPE equipment. We'll then complete the newborn blood spot test, weight and any other procedures that we're required to do on that day in the allocated room. Between day 10 and 12, we're required to see you for a face-to-face appointment in order to re-weigh the babies and to discharge you to the care of the GPs and health visitors if we're able to do so. We will call you on the morning of the appointment to complete the risk assessment. If low risk, this will go ahead as normal. If considered high risk, the appointment may be delayed and rescheduled for a time that is safer to do so. This will be arranged on an individual basis. During this time, we have set up a COVID-19 specific maternity helpline, which is available from 9 AM until 5 PM, 7 days a week. The contact number is 07817 825 264. For all other pregnancy-related questions, we ask that you continue to follow the normal guideline of contacting your midwife, the GP, ADAU or labour ward. The numbers for these places should be on the front of your pregnancy notes, and we ask that you do not delay contacting us if you have any concerns about yourself or your baby. We do ask that if you are required to attend the hospital, that you don't just turn up, but call before so that risk assessments can be completed. We understand that this is an extremely worrying time for the healthcare service and those that we care for. Our aim, as always, is to keep you and your families as well as our workforce safe. Please help us to do this by staying at home, practicing social distancing, ensuring you have good hand hygiene, and helping us to flatten the curve. Thank you.